everyone. I am Dr. Benin Rajesh, consultant pulmonology in Manipal Hospital, Jayanagar in Bengaluru. Today, March 24th, is celebrated as World Tuberculosis or World TB Day. Its aim is to bring awareness about tuberculosis and to result in its complete eradication. So, what is tuberculosis and why is it important? Tuberculosis is important because it is the leading cause of mortality in infectious diseases globally. In fact, in India, about 28 lakhs of cases are detected every year, leading to the death of about 4 lakh people every year. So, going forward, what is tuberculosis? Tuberculosis is an infectious disease that is caused by the Mycobacterium tuberculosis. It can spread from one person to another through air. That is, when a patient who is infected with tuberculosis coughs or sneezes or speaks, the bacteria in their lungs can come to the air, and when another person in their vicinity breathes this air, they can contract the bacterium. So do all people who breathe in this develop the disease? So here we need to look at a very important difference. The difference between tuberculosis infection and tuberculosis disease. When a patient breathes in a Mycobacterium tuberculosis bacteria, they can develop what we call as a tuberculosis infection, where the immune system controls the bacteria in the body. Due to any reason, when the immune system is unable to contain it, the bacteria can spread to different parts of the body, most commonly in the lungs, and cause tuberculosis disease. Among all the patients who are infected by the tuberculosis bacteria, only about 10% go on to develop the disease. The rest of them, the immune system is able to contain the bacteria, and this condition is called latent tuberculosis infection. So, what are the symptoms of tuberculosis disease? Tuberculosis most commonly affects the lungs, and the most common symptoms are cough with phlegm or sputum production, fever, night sweats, chills, and weight loss. These are the most common symptoms. However, it is also important to note that tuberculosis can affect any part of the body and symptoms can vary from individual to individual. For example, in a person with tuberculosis of the brain, they may have symptoms such as headache, nausea, vomiting, and fits. A person with abdominal tuberculosis may suffer from weight loss, fever, and constipation and irregular bowel habits. One might wonder why we sometimes see patients with tuberculosis having dangerous complications such as coughing up of blood or paralysis on their legs. Tuberculosis is a particularly dangerous disease because the initial symptoms are often very mild, like a mild cough or fever. When patients do not pay attention to this and these symptoms are ignored, the bacteria can spread rapidly in the lungs and also outside the lungs in different parts of the body. When it reaches an advanced stage, various complications can occur depending on the organ affected. When lungs are affected, serious complications can include what we call as a pneumothorax, that is air exiting the lungs and accumulating outside, coughing up of blood. Sometimes the spinal cord can be affected, which can cause paralysis. So, early detection and adequate and proper treatment is absolutely essential. One must note that one should not stop treatment midway. All issues during the course of treatment should be addressed by the treating physician and the adequate course should be completed so that we do not have recurrence of tuberculosis, its complications, or development of drug resistance. So, who are the individuals who have greater risk of developing tuberculosis? Any individual with reduced immunity or impaired immunity to various conditions like uncontrolled sugars, smoking, advanced age, taking immunosuppressive medications, and HIV are particularly at higher risk. Further, patients who are malnourished, elderly, and who are smoking have a greater risk of developing very serious or advanced disease. If a family member develops TB, what precautions should the others take in the family? If a person has tuberculosis, particularly of the lungs, it is possible that while coughing that they can spread the infection. But it is important to know that the infectivity decreases rapidly after initiation of treatment. The reduction in infectivity is seen in about 2 to 3 days, and after about 2 to 3 weeks of therapy, they are virtually non-infectious in most cases. If another person in the family develops symptoms, they should get it checked at the earliest with X-rays and sputum investigations. We should also ensure adequate ventilation at home with the windows open. Maintain a good physical distance, especially during sleep time. A distance of about 6 feet is at least recommended. Use masks at home whenever possible during these initial 2 to 3 weeks. In certain situations, tuberculosis preventive therapy is also recommended for the family members. Are there any vaccines available for the prevention of tuberculosis? Yes, the BCG vaccine, which is given at birth or in the first year of life, prevents serious forms of tuberculosis like miliary tuberculosis or brain tuberculosis, especially in the initial years after its administration. Various other vaccines are also being studied and are undergoing scientific trials in the world. My final message on World Tuberculosis Day is this: we must create awareness and end stigma around tuberculosis. Tuberculosis is a curable disease now with various advanced diagnostic and treatment options available. The government has also established multiple centers where these diagnostic facilities and treatment is provided fully free of charge. Even financial and nutritional support is provided through Nikshaya Poshan Yojana. We must also encourage all the patients who are affected with tuberculosis to complete their treatment course in its entirety. Together, we can end TB and we shall soon see a country without tuberculosis. Thank you everyone. For any doubts or concerns, please feel free to contact us at Manipal Hospital, Jayanagar. Thank you.